on the same Galaxy backbone and ensure that the wallet, at the end of the day, sir, when any patient makes a transaction, on your table will add it, you'll see total number of wallet transactions. So it could be in a day maybe 1.5 million. And that 1.5 million will now be, you won't touch the money, we won't touch it. Now the 1.5 million, when the patient that comes to access the service, like a prepaid service, it's a prepaid service, not a real-time service. So the patient has already put money, and it's their money. It's beautiful, it's stored in a bank. They don't even know, but it's stored. Now when you come to pay for PCB, or pay for an X-ray, or pay for admission, we're debiting from that money. We don't need to.
The coming of nursing backbone to our hospital has changed when we see our patients in terms of assessing services, in terms of making appointments and payment very fast, especially in terms of storing of data, research, and then confidentiality of our data. Because what you do before is use our manually papers, but when we introduce the electronic medical system, and we realize that still has a major challenge in which we used to have a lot of breakage in network service and also connectivity between the hospital and also within the hospital and between hospital and outside the hospital, whereby the patient cannot access services when he can always see problem of network problem. But the Camera of Galaxy actually has changed the way we go about it. And now we can have a very continuous, very fast network and also ensure our services to the patient in real time, and of course the safety of our data, because our data now is being hosted and stored by Galaxy and their research. So I think it has come a lot of improvement in our data services.
Efficiency into services, the world has moved from analog to digital, and that technology now it's making life easy and makes things easy for the patients, the staff themselves, the ease of doing business. And when you come to hospital, I mean, you don't add to the stress of a patient already, but technology makes it seamless for the patient to have a seamless experience, and so it's going to bring in efficiency, it's going to bring in increase in terms of job satisfaction for the staff that are working themselves. And of course, it will give us a secure data just in case anything happens. You can restore back those data that hitherto you've stored, and I mean there will be no loss. That's why I feel it's going to increase that, and then I think it will increase the IGR too, the internal generated revenue, because it will curtail human behavior in terms of payment and all of that. Since it's a scale network, I think we're good to go.
When I came on board as the Chief Medical Director, one of my first plan was to set up a system that will make it very easy for patients to access care, very easy for patients to interact with their caregivers, very easy for the caregivers to manage their patient, very easy for patients to develop confidence in our system. That's one of the things I plan to do. And during this presentation, he seemed to say everything about that. The way he presented it confidently, and the fact that he used an example of a place that they are already, providing this kind of solution to, it's awesome. It was easy to understand the presentation. It was easy for us to see that it's going to be a successful venture if we key into that. So I thought, okay, I've listened to so many people present EMR, and this is one of the best I've, because I saw a practical example of what it is all about. And